Hi, I'm Dr. Brittany Rush. I'm a chiropractor here at the Spinal and Sports Care Clinic. I specialize in treating women issues and pregnancy. So today we're going to talk about one of the techniques that we use to treat women in pregnancy who might have some issues with pain or who just want a more comfortable pregnancy. So the Webster technique is specialized for pregnant women, and it addresses dysfunction of the pelvis, the lower spine, and some of the muscles and ligaments in the area of discomfort. So we're going to look at the spine, and I'm going to show you some things here so you understand what I'm talking about. So the first thing that we do is the woman's going to lay face down on the table. We have comfortable cushions and pillows for that to be safe for you and your baby. We'll show you that in a little bit later. But while they're laying face down, we're going to check the pelvis to see if it's balanced or if there's some dysfunction in the joints. Dysfunction can lead to pain in the muscles, the ligaments, and even your joints. So while identifying if the pelvis is unbalanced, we're also going to be looking at the ligaments and some of the muscles in the area. So the SI joints are these things right here. A lot of women have pelvic pain during pregnancy. Studies show 1 in 4 women end up having pelvic pain during pregnancy. So we make sure that these joints here are balanced and where they're supposed to be. Then we check the ligaments down here. This is called the sacrotuberous ligament. It attaches from the sacrum to the ischial tuberosity down here. You don't need to remember any of these terms, but I just hold that and let it release until it, so it can help balance out the pelvis. The next thing that we do is we check the muscles in the area. So this is kind of where kind of your buttock is right here. So we're looking at these muscles to see if they're too tight, which could be causing some pain and dysfunction as well. So I make sure that we release these tight muscles so that those are balanced and happy. Then we're going to flip you over on the table. And as long as you're comfortable, we'll lay you on your back. And we're going to address the front of the pelvis here. So with the pelvis, there's the 2 joints in the back, and then there's one in the front. This is your pubic symphysis here. And I check to see if the pubic bones are lined up. A lot of women with pregnancy have pain in the front of their pelvis because there's a lot of front weight bearing from your baby being in the front here. So we're checking to make sure that these are balanced as well. Sometimes if one joint's off, the other joints can be off too. So they definitely are related and work together or against each other. So make sure that's balanced, and then we're going to check the ligament in the front. So with pregnant women especially, the round ligaments in the front can get tight and irritated. And something interesting about the round ligament is it actually has some muscle fibers related to it. So if these are too tight, they can spasm like a muscle and cause shooting pain down to your groin. So we check the round ligaments, both sides, to make sure they're not tight and causing some irritation. These can be tight if the pelvis is out of balance or if your baby's kind of on one side versus the other. So we're going to release those ligaments to make sure that they're balanced and doing okay. And then we're going to address this big muscle right here. This is called your psoas muscle. It attaches to the low back and to the hip. So if this is too tight, it can kind of cause some low back or even hip issues. But your baby's also growing right here. So if this is too tight, you can kind of close in and make it so that the baby doesn't have enough space to grow or as much as it should have to grow. So making sure that this muscle is not too tight and kind of closing in on the baby's space is a good thing to do too. So we always check that muscle both sides to see if that's too tight. Then we're going to release it gently to make sure that it's doing okay. So that's the Webster technique. We're looking at the joints of the pelvis in the front and the back. We're looking at the ligaments in the front and the back, and also some of the important muscles that could be causing some dysfunction of the pelvis and causing some of your pain issues. If you have any questions or would like to learn more about Webster technique or chiropractic and chiropractic during pregnancy, give us a call. Our phone number is 509-922-0303.